I'm the publisher of Modern Healthcare, and welcome to the second episode of Fridays with Fawn. Well, I'll be talking with some of my friends and colleagues about the issues women face in their career, our struggles, and more importantly, how to overcome them so we can continue to grow both professionally and personally. Today, I'm very excited to welcome Jhaymee Tynan, Assistant Vice President of Integration for Atrium Health. Jhaymee is also one of Modern Healthcare's top 25 emerging leaders for 2019. Welcome, Jhaymee.
Welcome. Thank you. Cheers.
Cheers. Good to have you.
Thank you.
Jhaymee, you've been in the workforce for about 20 years now, right? And I
Yes,
believe you started in finance. Is that correct?
that is correct. Yes.
Great. So finance is one of the more male-dominated fields. So how has it been for you? How has your experience been as a woman?
Well, I would say, ever since I started my career in finance, um, having to learn how to be assertive is one of the skill sets that I think has been a common theme throughout my career, both in finance and in healthcare. And, and in a male dominated field, when you look at men and their ability to be effortless and being assertive and being able to ask for what they need in their careers, you learn a lot from that. And you learn how important it is to be able to artfully advocate for yourself and be assertive. So that's something that I definitely learned early in my career. One of my biggest inspirations is actually Carla Harris from Morgan Stanley, and I wanted to be, a Black woman on in banking and being able to move that forward. And I was very passionate about that. And she was definitely someone I idolized and looked up to. But one of the things that she's been able to do as well is be assertive for what she needs in her career. And I think that's how she's been able to ascend the career ladder as quickly as she has been able to.
Good for you. But then you moved from finance, you moved into healthcare. What made you decide to move into healthcare?
Well, there were a couple of inflection points in my career where I made a decision to move into healthcare. One was I was in finance for a few years, and while I thought that was the career I wanted, I knew that I wanted to be able to make an impact. That was really important to me. I loved working with people. The other piece to that was my mother, who is a huge inspiration and influence in my life, was experiencing some health issues of her own. She had type 2 diabetes, and she also had heart disease, which made it very difficult for her to manage her day to day. And I went home to visit her one holiday season, and she asked me to run an errand for her to pick up her prescription for insulin. And I went to the pharmacy and picked up her prescription, and it cost her $700 to be able to pay for that. And I knew my mother was on a limited income. And I remember thinking to myself, how on earth can she afford $700 for medication? And more importantly, how does she make that decision between spending $700 on her medication or paying for her rent? And so it was at that point where I said, I don't think I'll ever go into becoming a doctor or a clinician, but there might be a way from a business perspective that I can make an impact. So I was able to transition into management consulting. I was consulting at Deloitte for several years in their healthcare practice, specifically working with the Veterans Administration. So that's really how I was able to make that transition into healthcare. And it has been a blessing to be able to make the impact that I think I can make from a business perspective.
Well, thank you for making the decision to go into
Yeah.
healthcare. We are very lucky to have you as part of our industry. So thank you. So Jhaymee, I understand you've had a number of very important mentors. How did you find your mentor? Tell us a little about that. And more importantly, how has having a mentor helped you in your career?
Absolutely. So mentorship has been instrumental in my career. And when I think about my early mentors, I actually didn't have language for what a mentor was. I just knew it was someone who I could go to for advice if I'm navigating something that's really challenging in the workplace, if I'm needing questions or having questions about, the next steps in my career. And it was just a safe place to truly be able to get some advice on my next steps. And I really love those relationships.
Glad you mentioned mentor and the difference between mentor and sponsor. I'd like to for you to talk a little more about that, but also um, I know you're on a panel discussion with Gail Capozalo at Women Leaders in Healthcare Conference, and where you'll be talking about mentor and mentee relationships and the importance of mentorship in one's career, right? Now that you're in a leadership position, have you taken on a mentee? And if so, how has the relationship been and how has it helped you to continue to develop as a leader?
It's a fantastic question. And I'm so glad you brought up Gail Capozalo because she has been a mentor for me in my career. In fact, we were matched up as part of the American College of Healthcare Executives executive diversity program for underrepresented minorities, and we were matched based on my career interests. So she's been a fantastic mentor for me. But to answer your question, I absolutely mentor others, and I have several mentees across different health systems in the country. And our relationships can be very formal and structured to very informal based on their needs. If they want to, a mentoring relationship that's ad hoc, where if they have questions, they reach out. We definitely connect that way. The other way is through monthly meetings. I have a mentee specifically here in the North Carolina area who we meet every Monday, every 2 weeks to talk about her growth and development. She's in the strategy profession in healthcare, as am I. So it's a great connection to just see how she's flourishing, how she's learning how to lead projects, how she's learning more about healthcare strategy. And I think it's my responsibility as an executive to be mentoring others and helping to lift up that next generation of leadership that is truly going to move us forward. So it excites me, it enriches me to be a mentor for others. And when I think about mentorship and sponsorship, mentorship, as I mentioned before, is about that advocacy, being able to about that advice, being able to advise you on the things in your career. And sponsors are about advocating for you, about talking about your accomplishments with their peers when you're not in the room, nominating you for high visibility projects so that you can have greater access to senior leadership, nominating you for industry awards so that your thought leadership and skills can be celebrated. So it's very active in being able to help you to get, visibility and a platform so that you can thrive.
How does one go about finding a sponsor?
Well, I think the first thing you need to think about is your network. You probably have a sponsor in your network today, whether they are very vocal or maybe they're a silent sponsor. But when I think about it, there's really 5 traits, I think, when you're trying to get a sponsor that you should focus on. Number one, they need to be courageous. They need to be willing to speak about you and advocate for you. Number two, they have to be committed to your success, right? They have to keep championing you to make sure that you get the high visibility projects that you think are going to help you develop the skills.
So we're certainly in some very challenging times right now, right? So our nation is facing a double pandemic. It's been very tough the last few months, and when coupled with the unrest of the past weeks, more than ever now, we need to come together as a community. So, how have you been dealing with all this uncertainty as a woman and as a woman of color?
Wonderful question. Thank you for asking that. I would say that I'm dealing probably as best as any other woman of color is right now. You talked about uncertainty. There's a term called VUCA, right? So we're living in this very volatile, uncertain, complex, and ambiguous world. and we're trying to navigate it in the only way that we know that we can. I think what I've leaned into very much during this pandemic and all of the social unrest is focusing on my wellness. So definitely giving myself space to be angry and frustrated and sad, and letting my teammates know that they can also feel those things. I've also leaned into my sister circle. So I have some really trusted girlfriends um, from all across the country that are experiencing the same things I am. And we talk very regularly. We do virtual happy hours, virtual breakfasts, where we just talk about what we're feeling and thinking. But I think the most important thing in dealing with all of this uncertainty is having as much and extending as much grace as you can to one another. Be kind to one another. And you never know what someone is dealing with and how this whole pandemic and social unrest is affecting them. So how can you be a gracious leader? How can you be an empathic leader? How can you step aside from the day to day and truly and authentically care about the teams that you lead and giving them that space? And so I've really leaned into gratitude and kindness in this pandemic.
Great advice, great tips. And I must admit, both personally and as a leader, a business leader, I have felt the stress of the unrest and uncertainty. As a nation, we've witnessed the shock, frustration, disappointment, anger, you name it, by all people of all stripes and colors. And one of the things, like you, that has helped me is my leaning in, relying on my network, my circle of influence, my support system, my community. And this is why I'm really excited about Women Leaders in Healthcare Conference. This community of women has been so inspirational and so supportive of me and of so many others that I know of. So you've attended Women Leaders in Healthcare Conference in the past. Certainly this year it's different, being that it is virtual, but the content is as good, if not better, and the community connection, the networking, and the building of your support system is, I think, better than before. So I'd love to hear from you what you're looking for from this year's event.
I looked at the agenda and it looks absolutely amazing. I think all of the speakers are top notch and they're experts in their field. Everything from how do you build your social media presence to how are you focusing on women leadership in your organizations, mentorship you mentioned before. And what's unique about all of the agenda topics is they're even more relevant now that we are in this remote work environment. You still have to do those things to be able to continue down your career path. And bringing in the elements on how do you do that in a smart way in a virtual environment, I think will be very helpful for a lot of attendees that are struggling to make those connections in a virtual way. But I'm also very excited to hear from all the speakers on the lineup. And it has been my pleasure to serve on the 2020 advisory board, where we started curating women across the country who we thought would be fantastic. And all of them are absolutely top notch and virtual. So that even makes it better and even more of a engaging experience now that we're going to be connected virtually.
Jhaymee, thank you for joining me on Fridays with Fawn, and thank you for all that you do. Thank you for being part of our advisory committee this year, and thank you to our audience for tuning in. We will see you again in a couple of weeks, where I will be speaking with Annette Walker, President of City of Hope, Orange County. Thank you.